Hi, I'm Dr. Salamay, and I'm going to show you today how to conquer back pain with 5 easy strategies. So number one, what we want to do is we want to address spinal related problems. So spinal related problems can be a big issue when it comes to back pain. Obviously, people are more familiar with that than anything else. But we're going to be talking about some other things that also can affect back pain that we usually aren't too aware of. But one of the things is that with spinal related problems, usually the things that we really relate to are like injuries, such as sports, contact sports, car accidents, trips, falls, all these things, or just lifting things and just pulling things or muscle being pulled or something affecting us. So all of these things are what we call as macro trauma. So these are traumas that occur on a larger scale. And what happens is they affect us and they cause injury, and they can cause issues to the spine, cause inflammation, and cause pain. So the big part of pain is inflammation. So that's the big key. These are these chemicals such as substance P and bradykinin that these are chemicals that they go up into the area in the brain, and they cause our brain to perceive pain, and they're released out of the nerve fibers. So these are things that can be affected. Now, another thing is that we also have micro trauma, and these are the things that we're just not usually aware of. And this includes me. I mean, we could be sitting in a spot, and maybe our head is elevated too high, or our workstation is not right at eye level. So we want to make sure that we have good posture and ergonomics. So a good chair, a good mattress. And what do we mean by a good chair? A good chair should have a good lumbar support, should have a good back support. When you're sitting in a chair, your chair should keep your spine in an upright fashion. It shouldn't be going forward or sagging in. A lot of times we kind of get adapted to a certain posture and think that's normal, and then we end up finding it's like, whoa, what hit me? I just woke up and I have all this back pain. So sitting in a good chair, sleeping properly, sleeping with basically with our head supporting our neck, where our neck is not propped up or our head is not sagging. These are things that can make a big difference. A lot of us tend to, when we carry something, we just bend over and just use our back. And that may be okay for a couple times, but eventually what happens over the course, if we continue to exert ourselves and bend over and stoop over and pick weight with our back, this can cause a really big issue when it comes to injury. And we don't know, they're called micro traumas because they're so small and we don't think about them usually, but then they just happen over and over and over. And these chronic micro stresses that continue to occur tend to equate into a big, big trauma. Another thing is that one of the things is that back exercises are also things that you can do to help prevent these type of injuries. So exercises can be very, very important to help prevent injury and help prevent problems going down the road. So we practice good, proper ergonomics. We do our best, but then we can also incorporate exercises. And one of my favorite exercises is the psoas muscle. And the psoas muscle basically attaches from T12, T11, T10, and it's got attachments all the way into our lower hip area, and allows us to raise our leg. It allows us to be able to move. It's a hip flexor muscle, but that muscle attaches to our discs in our lower back. So whenever that muscle is really tight, that can cause a lot of back pain. So psoas stretches are going to be very, very important that you can do, and that can help alleviate a lot of back pain and prevent overuse injury and prevent big traumas, such as if you're working out in the gym, or you're doing a squat, or you're doing a deadlift. If your psoas muscles are strong and they're well flexible and they're stretched and everything, that can really, really prevent. Another thing is the piriformis muscle. That is a very, very important muscle, and that muscle also helps and create biomechanical stability in the spine, primarily the hip, and it's one of those muscles that is familiar with people that have sciatica, because that muscle can, when it contracts, and a lot of the population actually can pierce the sciatic nerve or traverse it, and basically compresses the nerve because it's right in that buttock area. So that, along with doing glute exercises and glute stretches, can also be very helpful in preventing lower back injuries. We also want to do erector spinae. These are the muscles that go along the sides of our back, and they allow us to be erect or upright. And that muscle, those muscles, stretching those muscles, such as bending forward, and you can go bending forward on a stability ball. There's all sorts of things you can get on a foam roller and roll along those muscles. That can be very, very helpful in terms of stretching the erector spinae muscle. And of course, our abdominals. So stretching our abdominals as well as strengthening our abdominals and doing planks. Doing planks can be very, very helpful for core stability as well as strengthening the erector spinae muscle. And these muscles are what really, really help support the spinal structure and really create like a belt to really support and protect you. And that's really what we want. A lot of people walk around carrying belts and wearing those for the gym and things like that. But really what we really want is if we have our own bodies are really working functionally, it can make a tremendous difference. So you want to get your body in that proper, with good flexibility and be able to have good tone and good strength. If we have both of those and we have combined with good sound spinal alignment, it's going to do us a really, really good in order to keep our body from having more pain and so on. So another thing is that we want to avoid the don'ts. Do's and don'ts. The do's I've mentioned, as we mentioned a little bit earlier, the do's, we want to make sure that we're sitting, in an upright position. We're not slouched over. We have a good pillow, a pillow that is really that's supporting the neck, where your neck is really, really not tight when you're laying down. It's not propped up. It's not hanging when you sleep. And if you're waking up in the morning and your neck is tighter than when you went to bed with, chances are you really want to look and investigate your pillow. There's all sorts of pillows out there. I'm not pushing or suggesting one particular pillow, but there are different types of pillows for different people. Each pillow works, for some people may work really well, but for others, another pillow may work better. So sometimes people do with a good old-fashioned feather pillow. Some people do good with like a Tempur-Pedic pillow. There are all different types of pillows out there. The main concept that I want you to know is as long as your muscles are in a relaxed position and it's at level, that is very key. So when you're waking up, you're not waking up with tense muscles either in the front or in the back, and that's, going to continue to affect you. Another thing is people ask me all the time, what do you think of a mattress? What kind of mattress do you recommend? Really, it just depends on the person, but really as a general rule of thumb, we want a firm mattress. Doesn't have to be extremely hard, but we want a nice firm mattress where things are at leveled and that your back is supported. You don't want one side of your hip hanging or sagging because of the imbalance in the mattress. So always look at your mattress. If your mattress is over 10 years old, you might start noticing some things starting already to wear with the mattress, and you might want to start looking at getting a better mattress, and a mattress that is going to be contoured to your body, or at least at level where it's not too soft but not too hard. One of those things is, and there are mattresses out there that'll let you try out, and you may try out for a week and you'll know. Again, if you wake up and you're feeling that you're having more pain, then chances are the mattress is not good. So those things. For the ladies, they tend to carry these purses. These are one of the don'ts that we don't want to do, is that ladies tend to carry these purses. These handbags are really heavy. I really suggest not carrying these or not putting as much weight, because if we're strapping on weight on one side of the shoulder, it's going to cause issues and it's going to cause compression. So it's important. Another thing for the men that are carrying wallets, I know it was a habit. I carried a wallet in my back pocket for years, but at when I went to the chiropractor and he told me, hey, you got to stop carrying the wallet in my back pocket, then I said, yeah, you're right, because I would get up and walk and my back would hurt me even more. So you don't want to be sitting on a rock. You don't want to be carrying a weight, even though it may be, I don't know how many pounds, a pound or two, whatever is in the weight of your wallet, but we don't want to be carrying that and be pushing on it, because that's part of a micro trauma. That's part of that stressors that continue on. So these things can help. Another thing is we like to read. I like to read, but we want to make sure that we're not reading in bed when our heads are propped up. So that can be an issue, or laying on the couch with, where our head is resting on the armrest. We don't want to do that. So all of these things make a big difference when it comes to conquering back pain. These are strategies and things that you can do. I know a lot of them sound, like common sense, but we tend to make these and not think about them, and they end up becoming a problem. And a lot of times it's really not that complex. So as for this covers the structural part of conquering back pain, but what about other hidden triggers of back pain? The things that we don't really think about. What about if I told you that food could affect your back pain? What about if I told you maybe the bread that you ate that day, or maybe the processed food that you had, or you were on the go and you had to eat something, maybe that triggered or inflamed your back? And people may think, well, how would that affect? What happens is when there's inflammation, and we can get inflammation from all different sources, but if we're inflaming when we eat a food, our immune system is reacting to some type of food, and it just doesn't like it for whatever reason, because it's processed, because the immune system doesn't recognize it, that can cause a lot of inflammation, and that inflammation can affect the nerve fibers, and that can also refer into the back. So if we eat something, for instance, like dairy, and it inflames our intestines, well, we have referred areas from our intestines all the way into our back. And that can cause a lot of lower back pain. And we may not think that it may be related to, the milk that we had. So these are things that we want to pay attention to. One of the things that foods that cause inflammation is the gluten. Also other foods such as dairy, which dairy not just has the lactose, but it also has casein in it, which is very similar to gluten. So whether you're reacting to gluten, you may be fine with those foods. But whether you're reacting to gluten, or you're reacting to the dairy or the soy or eggs, these foods are common food allergens. Or corn, that's another one. So this is what I suggest. What I suggest is go for 30 days, completely remove all foods that you may suspect, and this includes all grains, and then reintroduce each food at a time. After 30 days, if you take in eggs and you don't react, you don't bloat, or you don't feel off, or you don't feel, then chances are, then that food is fine. Same thing that applies to any of the other foods. If you're having any milk or having any bread, and it's causing you to feel ill or just not feeling well, you'll know, because once you remove those foods for a while and you reintroduce them, the immune system will be much more pronounced, and that effect, you may notice that effect, because after a while, if we keep eating the same foods that we're actually sensitive to or allergic to, what happens? We kind of get numbed out, and we don't really feel it anymore. And that's not a good thing, because later on that can lead to more and more problems. So it's kind of a good thing that our body kind of tells us when we're not feeling well. And the thing is with food and food sensitivities, these sensitivities may not be immediate. So they may be delayed. It could be 8-16 hours after your post meal before you notice that you may not be feeling well, and you don't really know why exactly that happened. But I assure you, if you follow that 30-day elimination diet and you reintroduce the food, one food at a time, don't do all of them, just do one food at a time as a test, I guarantee you're going to start noticing more things, and you may be more in tune. You're going to be more in tune with your body and know what really affects you. So that's one of the good things. And lastly, what we want to cover is the fifth strategy to conquer chronic back pain is check your hormones. And I know when it comes to hormones, people don't really think about it, but the hormones are extremely important when it comes to our muscle strength, our joint strength, our bone mass. All of those play a big role in our biomechanical stability and spinal stability. So what we do in our office is we check patients for problems with their adrenal glands and problems with their adrenal hormones and their sex hormones. So like testosterone, estrogen, progesterone. All of these hormones, the steroid hormones, basically the steroid hormones starts with pregnenolone, really starts with cholesterol. Cholesterol gets converted into pregnenolone, and then it converts into all these other hormones like DHEA, like cortisol, like progesterone, like testosterone, and so on and so forth. So if we're deficient in any of those hormones, or we're producing too much of one, but there's just an imbalance going on, what we want to do is we want to make sure that all of them are working correctly and all of them are at the optimal levels. So people can relate to this, because when you think about it, you look at people who do sports and who are lifting weights or in the gym. If you've got low testosterone, what are the chances that you're going to recover very well from a workout or build muscle? Not too well. But if your testosterone levels are optimal, you have stronger muscles, you got stronger joints. So all these hormones are important. Even growth hormones are important too. So people who are, growth hormones very good for your cartilage. So all of these hormones are really important. Now, it's not so easy to really cover this. I know it's part of the 5 easy strategies, but if you can get your general doctor to test you for your hormones, and they run your hormones and see if there's any type of deficiency, then that can be a lifesaver when it comes to supporting your back, supporting your overall function, and just feeling really well altogether. So it's very important that you get your hormones assessed, and that is important, especially if you've tried everything. I mean, if you're doing chiropractic and you're doing physical therapy and you're doing everything right, you're doing everything that we've mentioned basically and more, and you're still not holding your adjustments, or you're not holding your back is just not holding well, regardless of what you do, then the chances are is that I would really check your hormones and see what your hormone profile looks like, because the answer may be there. So what I want to do is I wanted to recap of what we just talked about. Number 1 is addressing your spinal stability, making sure that your spine and your biomechanics are correct, whether you're getting physical therapy or you're getting chiropractic or even both. That's important to do. Another thing is taking care of your back. Taking care of your back, doing your back exercises, following the do's and don'ts, and making sure you're not doing things that are injuring yourself, and eating an anti-inflammatory diet, which is avoid your food sensitivities. Eliminate the 30-day, for 30 days, eliminate those foods. Don't consume any of the foods the common food allergens that I mentioned. Another thing is eat foods that are high in omega-3. So that's another thing. So omega-3 is very anti-inflammatory. Make sure you're eating enough omega-3s and reducing amount of omega-6s. And omega-6s are going to be pretty much everything else. It's going to be all your other oils, your olive oil, all these polyunsaturated oils, saturated fats, and of course trans fats. You want to avoid them altogether. So eat more omega-3 foods. Get in high quality fiber. Get enough fiber. Get about 30 grams of fiber a day. And your omega-3 foods are going to be your walnuts. They're going to be your chia seeds, your flax seeds, your fish. Make sure you're getting enough of those. And of course, like I said before, lastly, make sure you check your hormones. Make sure those are all in check. And if you do all the rest, I'm sure you're going to have a much better outcome, and you're going to be able to conquer your back pain. First of all, I want to thank you for watching this video. If you like what you see and you want to see more of these type of videos on any type of topics, please type them in the comments below. I'd be happy to make more videos of whatever interests you. And please hit the like and subscribe button, hit that bell notification, and that helps the algorithms, and that helps us continue to be able to provide more information, educational information. I want to again thank you again, and I'm Dr. Tony Salamay, and I want to wish you a great day.